Dear colleagues and friends, welcome to our panel today that brings together leaders from climate science, forest conservation, and public health to discuss how we can work together across disciplines and sectors to address these challenges holistically and systemically. My name is Paulette Frank, and I have the privilege to serve as Johnson & Johnson's Worldwide Vice President of Environmental Health, Safety, and Sustainability. We are incredibly proud to return to Climate Week 2020 as a gold sponsor. I had the honor of speaking to this community last year when Johnson & Johnson hosted a panel on the interrelationship between women's health and planetary health. Together, we examined the disproportionate impact that climate change, environmental degradation, and pollution have on women and other marginalized populations, while also highlighting the leading role that women are playing in the fight against climate change. This past year, we have all been understandably consumed with the COVID-19 pandemic. I'd like to begin by extending my heartfelt sympathies and condolences to those in the audience and around the world who have lost loved ones, faced illness, and experienced unexpected hardship as a result of COVID-19. I also know that there is a deep worry amongst those of us concerned with the state of our climate, that the pandemic may diminish or delay the need for urgent climate action now. The decade of action is admittedly off to, well, an interesting start. But while some may see the circumstances of the past 9 months as a setback, we at Johnson & Johnson see it as an inspiration to propel our climate action further, faster. We understand that the health and well-being of people and the planet are fundamentally linked. As difficult and painful as it has been, the pandemic has taught us several invaluable lessons about our collective vulnerability and responsibility to each other and to the one planet that we all call home. More than that, this past year has shown us our capacity for bravery and shared action in response to a global threat to the health of humanity. At Johnson & Johnson, we have seen that bravery firsthand in the frontline healthcare workers, the doctors, nurses, caregivers, and emergency responders who have been treating patients often to the point of exhaustion. We have seen that bravery in our own on-site superheroes, our essential employees who are working to manufacture and deliver the products and breakthrough interventions that protect us and will ultimately defeat this virus. We have seen that bravery in the patients and their loved ones, and indeed in entire societies facing down this difficult disease, with the hope not just of survival, but of renewal. Inspired by all of them, Johnson & Johnson is accelerating our climate action with a new set of commitments, which I am so pleased to share with you today. We began setting public climate goals 20 years ago, and our new climate commitments are our boldest and most ambitious yet. Building on our strong legacy, by 2030, we aim to achieve carbon neutrality in our own operations. And in order to achieve this goal, we will need to exceed what the science tells us is necessary to help keep our planet below 1.5 degrees Celsius of temperature rise. To help meet this goal, we are aggressively accelerating our target for 100% renewable electricity from 2050 to 2025. In addition, we are committing to work with our suppliers to reduce our upstream carbon footprint by 20% by 2030. This work will deliver nearly 2.5 times the carbon footprint reduction compared to our own operations. We are not alone in stepping up to the challenge of shaping a more resilient future. During the pandemic, many of us have stepped up in our own individual ways, taking on new roles, wearing new hats in our professional and personal lives, a testament to what we are capable of when faced with the urgency and scale of a global public health threat. For me, in addition to my day job at Johnson & Johnson, at the onset of the pandemic, I took on an assignment to coordinate the development and manufacture of millions of bottles of hand sanitizer at several of our facilities around the world. When 2020 started, I would never have imagined that a new product launch would be amongst my most proud accomplishments, not only of the year, but of my career. And to the lifelong job of being a mom, during quarantine, I added the roles of teacher, tech support, cafeteria supervisor, and chief PPE procurement officer. But with these new hats also came some gems. My oldest son became our in-house barista, and afternoon coffee breaks became opportunities to share what each of us was working on for the day. Being environmentally conscious himself, he shared his worries of how his metal straw would be no match for all the single-use plastics making a comeback, and how he was more determined than ever to stick with his beef-free diet. So when Johnson & Johnson accelerates its renewable electricity goal by 25 years, I'm not just proud to share this news with you, I'm so proud to tell my son that instead of being 45 with a family of his own, we'll be running our sites on 100% renewable electricity before he's out of college. Of course, the challenge ahead is daunting. In the past 2 decades alone, humanity has emitted more carbon dioxide into the atmosphere than the mass of all living matter currently on Earth. All people, all plants, and even all bacteria, fungi, and viruses. Yet, just as the world has accelerated its release of greenhouse gas emissions, we can also accelerate its reduction and removal. The impacts of climate change are no longer decades away. They are happening now. From the devastating forest fires in the Western US, the Amazon, Siberia, yes, Siberia, and Australia, to the increases in the intensity and number of droughts, floods, and hurricanes happening throughout the world. In terms of human health and new infectious diseases, we have also seen an acceleration over the past 2 decades. Not only are we still battling the HIV pandemic, which began in 1981, but since 2000, we have seen outbreaks of SARS, swine flu, MERS, Ebola, Zika, and of course, COVID-19. The threat of deforestation exacerbates both climate change and the emergence of new infectious diseases. The world's forests serve many critical ecosystem functions, including being one of the world's great carbon sinks and protecting biodiversity. The great forests of the world provide livelihoods for the people and local communities who in turn safeguard them. And trees are critical to our personal health and well-being in ways big and small, from being a buffer between us and new infectious diseases to the oxygen we breathe, to the relief of shade on a sunny day, or the joy of swinging from a branch. Protecting forests pay back multiple dividends to human and environmental health and well-being. And to ensure we protect these benefits for us today and for future generations, conservationists may have to start thinking of themselves as public health advocates, and public health advocates may need to think of themselves as environmental stewards. Again, the COVID-19 pandemic has taught us all that we can wear more than one hat, that we can take on new roles and get new jobs done, even ones we never imagined doing before. We have a saying at J&J. It's actually a quote from the founder of our pharmaceutical business, Paul Janssen. He would say, "Patients are waiting." These 3 simple words give you an immediate sense of the urgency and what's at stake for people waiting for solutions that could change the trajectory of their health. For someone like me, who hasn't met a tree she hasn't loved, the forests are waiting. They are waiting, watching, and recording our actions. Each year, a new ring recording, among many other things, the quality of air that we breathe and the carbon intensity of our atmosphere. What will their rings show this year? What will they show next? From this year forth, every year will either reflect a year of action or inaction. At Johnson & Johnson, we believe in the power of partnership. It's time to throw more hats in the ring, to convene more voices, and to mobilize resources across the environmental, medical, and public health communities to care for the planet like our health depends on it, because it does. Now that sounds worthy of the decade of action. With that, I would now like to turn it over to my colleague, Phil Dolan, to open our panel that will examine in greater detail systemic approaches and pathways for action across climate science, forest conservation, and public health.
Paulette, thank you so much for your inspiring opening remarks. I'm glad that you include some personal touches in your remarks because I'm convinced that the more that we personalize these issues and make them real to people in their everyday lives, that it's more likely that we'll enlist others to join in and we can amplify and accelerate progress. As Paulette mentioned, I'm Phil Dolan. I'm the Global Director of Sustainability for Johnson & Johnson, and I have the great privilege of moderating today's panel. Normally, we'd all be in a room in the hub in New York City, but today I'm speaking to you from my home outside of Philadelphia, Pennsylvania. Today, we will be discussing the intertwined issues of climate change, deforestation, and pandemics, and how we can start to break down silos and address these issues in a more systemic and holistic way so that we can improve outcomes in all these areas with a unified effort. I have an amazing panel with me today, and I will briefly introduce each of them and ask them to tell the audience a little bit about themselves, their organizations, and their roles. Virtual meetings do have some advantages because our panelists are joining us from varied locations across the US and Europe, and we have all reduced our carbon footprints by joining from home. However, I do miss the delicious organic snacks at the hub, so maybe next year. We're going to move in the order that I will ask the initial panel questions. So I would like to start with Kerry Cesario from WWF, who's joining us today from the greater Washington, D.C. area. So Kerry, would you please introduce yourself?
Yeah, thanks, Phil. So as Phil said, I'm Kerry Cesario. I am the Senior Vice President for Forests at WWF US. And if you don't know WWF by our ubiquitous panda logo, I can tell you that we are one of the largest conservation organizations in the world. We operate in nearly 100 countries. And when the organization was founded nearly 60 years ago, it was with a focus on wildlife and wild places. But there's a real recognition that that nature has so many contributions to humans, and our organization has evolved along with the rest of the conservation movement or sector. And we're completely committed to supporting those contributions and really maintaining and enhancing them. And that is a fundamental component of our mission and a big part of my role now at WWF. My career at WWF has evolved as well over nearly 20 years. When I first started at WWF, it was with a focus of working with companies to use their supply chains to help to drive improvements in the management of the world's forests. And that's actually when I first got to meet Paulette. Today, I lead a team that works on an array of ways to maintain the health and intactness of forests around the world. Many different interventions, but very importantly, also considering the role that forests play in mitigating climate change. And most recently, my team is now part of an interdepartmental team that is working on the role of conservation in addressing global pandemics. And I'm really excited to tell you a little bit more about that and be part of this panel. So thank you.
Excellent. Thank you, Kerry. Next, I'd like to introduce Madeline Thompson from the Wellcome Trust, who is joining us from the greater London area. Madeline, would you please introduce yourself?
Thank you, Philip. I'm delighted. I'm actually heading back to New York tomorrow, so I'm going to be there during the week, which is very exciting. I've been living there actually for the last 17 years. During this time, I led the health work at Columbia University's International Research Institute for Climate and Society and was the director of the WHO Collaborating Center on malaria early warning systems and other infectious diseases. And currently, I'm leading the climate work at the UK's Wellcome Trust. As a kind of role reversal, leading the health work in a climate institute and now leading the climate work in a health institute. And where I'm the interim director of a priority area called Our Planet, Our Health. For those of you who are not familiar with the Trust, let me just give you a very quick background. The Trust was founded in 1936 by a gentleman called Sir Henry Wellcome. He was a medical entrepreneur and collector and a philanthropist, and he left his entire wealth to the Trust. How we work today reflects the breadth of his interests and his conviction that health can be improved when research generates, tests and investigates new ideas. So Wellcome really exists to improve health for everyone by helping great ideas to thrive. Now, the Wellcome Trust is politically and financially independent. It's one of the largest global foundations, and it dispenses about £1 billion a year in support of its global mission. It's in the midst of a major strategy and science review, and I encourage you to look out for the fruits of this process in the latter half of October. So I'll leave you there.
Thank you, Madeline. And finally, I would like to introduce Ari Bernstein from Harvard University, who's joining us from the greater Boston area. So Ari, would you please do the honors?
Thanks, Phil, and thanks for the opportunity to be with you. And it's an honor to be on a panel with Kerry and Madeline and talk about issues that I know we all think a lot about in the middle of Climate Week. And this year's Climate Week is arguably more important than ever as it occurs in the middle of an arguably unprecedented global pandemic, which has very much called into question whether climate action can keep a pace when people are focused on something else. I'm the interim director of the Center for Climate Health and the Global Environment at the Harvard Chan School of Public Health, and I'm a pediatrician at Boston Children's Hospital. And so I spend half my time taking care of people and half my time taking care of the planet. And I really see how these two things go together quite well, and recognize the real tension that I just presented between the focus on climate and the focus on a pandemic, and realize pretty quickly that many of the solutions that are in play for climate are exactly the solutions we need to prevent pandemics. And when we get into these, arguably messier problems, stickier problems of global environmental change, the solution spaces are reassuring that we can actually make a big difference in many ways with the same set of solutions, and that critically the solutions benefit the folks who've been hit hardest in so many ways by environmental threats. And I look forward to having the chance to talk more about those during the panel.
Sounds good. And I want to thank you all for taking time out to join this panel. And Madeline, too, a special thanks to you for dialing in late in the evening in the UK, especially as I know you're preparing to do something that many of us have not really thought about since very early this year, which is to get on a plane. So we wish you very safe and healthy travels. So I want to move to the panel questions. And Kerry, I'll start with you. And you alluded to this, but over the past few years, we've seen WWF evolve to focus on a more inclusive definition of health. And, one that involves animal, ecosystem, and human health. And we've really seen that evolution come forward in your recent, document that was called An Urgent Call to Protect People and Nature, in which WWF calls for humanity to fix their relationship with nature, which is a good call in my opinion. I'm wondering what WWF has had to do in terms of changes, whether it's internal or structural changes or new partnerships, new ways of communicating in order to work more systemically, especially at the intersection of climate, deforestation, and health. And, if there's any lessons learned along the way from that evolution, you could share those with us. We'd appreciate that as well.
Great, thanks, Phil. That question, or series of questions, really, I think sets me up to talk about a couple of things I really wanted to raise, and one is, just this question or kind of the concept of the role of conservation and what organizations like WWF can do to address global pandemics. As I alluded to in my intro, WWF is increasingly working on what I'd call interconnected solutions. So I mentioned the role of forests. I mean, if we protect forests, that helps to address climate change. Obviously, the role of nature in supporting human well-being. And we've also engaged over past decades on health and environment projects, sometimes with J&J. So there's some history there. But I have to say that COVID-19 certainly brought that concept into sharp focus for our organization, as it did for many others. And we were able to mobilize quickly to do an assessment of the science around the root causes of zoonotic diseases. So zoonotic diseases being, diseases that transfer from animals to humans, COVID-19 being one of those. And what we found was that there were three direct drivers of change that result in the greatest risk of emerging infectious disease in terms of exposure and vulnerability. And they are land use change, so the degradation of nature or loss of nature, such as we see in deforestation, the expansion and intensification of agriculture and animal production, and the sale and consumption of high-risk wild animals. So if there's any question about does conservation have a role to play in preventing pandemics, I think the answer is yes. But last year, and this is so pre-COVID, we got some advice. We were hosting a science symposium, our Fuller Science for Nature Symposium, and it was on the topic of healthy planet, healthy people. And one of the experts said to us, don't try to be health experts. And by that, he meant don't try to replicate competencies that are readily available in the health sector. And so I think we really took that on board. But at the same time, we are experts on forests and on deforestation. And deforestation is the dominant driver across all zoonotic pathogen types. And also noting the role of climate change in amplifying impacts or serving as a driver itself in some cases. I would say essentially we are health experts, just a different kind of health expert, and maybe picking up on Paulette's point that conservationists need to see themselves as public health advocates and vice versa. So as a conservation organization, we need to focus on the root causes. This is at the intersection of humans and the natural world. But that's also where we have opportunity to have the biggest bang for the buck. So if we can address disease at before the point of spillover, for example, on deforestation frontiers, we also have an opportunity to help to address climate change, to conserve biodiversity. So there's a myriad of co-benefits in doing that. So in the wake of COVID, we launched a coordinated global effort to engage stakeholders around the world to raise awareness and to advocate for action to address global pandemics. But WWF had already been, so we're going to be scaling around these drivers, but interestingly, a couple of years ago, we began a more concerted effort to look at these intersections, specifically of forests and health. And I think I think people intuitively understand that forests are important for human health, we don't necessarily see that understanding in how decisions are made or in how we approach problem solving. I think in the experience of many people, and certainly mine, working on forest conservation around the world, in many of the countries we work in, if you're working on deforestation or environmental degradation, you're working with the Department of Natural Resources or the Ministry of Forestry, and then health issues are dealt with by the Ministry of Health, and then there's the Ministry of Finance that kind of comes in and sort of quashes everyone's plans and hopes and dreams. Anyway, but the I mean, I'm joking a little bit, but the reality is that both the planning and then I think the funding to support those efforts is completely separate. So WWF wanted to contribute to addressing this problem, and as a science-based organization, I think we wanted to help to bring the relevant and available evidence to bear in decision making, and as an organization that truly believes in the power of partnerships, we wanted to expand the alliances that we were involved in, forge alliances with the health sector. And so last year, I was really pleased that we were able to launch a new initiative with Johnson & Johnson, our Forest and Health Initiative, which includes a research component to look at the intersection, sort of draw out the connections between forests and health issues. So not just infectious disease, but non-communicable diseases, impacts of air and water pollution, physical risk, nutrition. Try to compile and understand those connections, and also how forest conservation interventions might help to positively impact on those issues. the project also has a sort of effort to learn, kind of to learn and then sort of put these ideas into practice. And so we're working in Sabah, Malaysia, and that's in collaboration with EcoHealth Alliance. And I really want to give a big shout out to EcoHealth Alliance, a partner also of Johnson & Johnson, just for the amazing foundational work they've done, and certainly for their effort in Malaysia. So in Sabah, this is a place that's been decimated by deforestation for palm oil production. It's also a place where diseases like malaria are linked to forest loss. And in fact, Sabah is considered ground zero for a novel zoonotic malaria that's emerged that transmits from monkeys after forest loss. So we're working to understand how much degradation can forests withstand before you trigger a potential cascade of negative and potentially irreversible consequences, both for nature and people, and then working with local business and governments to use that information and make better land use planning decisions. So it's really exciting. So I think to summarize, I would say that conservationists certainly have a role to play at these intersections, helping to bring the message and advocate for addressing root causes. But I think the messenger matters, and it really has to be done both with and in some cases probably through trusted voices on the health sector side. And I think there's opportunity to bring that message in a salient way to decision makers. And I think in this very unique time, also an opportunity to bring that message to individuals, to make that really meaningful for people and the broader population. And finally, just to say that I think it's hard to do things that we're not used to doing. We have different vocabularies, different societies, different clubs we all go to, and that sort of thing. And so I think anytime we can showcase partnerships that are working, or sort of show this is how we might try to do things differently, we need to hold up those examples and use them as cases. So I'll stop there. Thanks.
Thank you, Kerry. Next, I'd like to virtually turn to Madeline. Madeline, you alluded to this in your intro, but I think most people know the Wellcome Trust for their work in supporting better health through investments in health products and treatments, and advancing clinical research and public health interventions, especially in the areas of drug-resistant infections, vaccines, and mental health. And but I don't think a whole lot of people know that the Trust created this unique initiative, Our Planet, Our Health, and to me, this is groundbreaking work for a health-oriented funding organization, and it's highly unusual in my experience for health organizations to invest in these environmental issues. So can you elaborate a little bit more about the initiative and touch on why you think this is an unusual approach or unique approach? And do you see opportunities going forward to bring funders together to co-fund attempts to address climate, deforestation, and pandemic prevention in a collective manner?
Well, that's a lot of questions. Thank you. And yes, of course, the Trust is well known particularly for its infectious disease work, and actually its visibility has grown enormously, of course, through its investments in COVID response and in therapeutics and in developing collaborative platforms to responding to the current pandemic. But the Trust has been thinking about broader drivers of health outcomes for some time now, and at least for 10 years, on the intersection of environment, health, and nutrition. This eventually became formulated as Our Planet, Our Health in 2015, with a specific focus on cities, food systems, and climate, but not necessarily all working together. So some initiatives around food, some initiatives on cities, and climate has really come into this program through co-benefits of improved food systems, better health, if you like, for individuals, and better health for the planet, and on city design, urban infrastructure, etc., which is better for people and also has a lower carbon footprint. So Our Planet, Our Health has been actually one of the main substantial funders in this space for a few years now. Our funding envelope was £75 million. and invested in a number of major research consortium. And what was really prioritized there was not only top-end science and really good scientific teams with a global consortium, but that connection to policy and that willingness to really invest time in engaging policymakers in the formulation of the questions that were going to be addressed and ensuring that those pathways would be available for research uptake once the research had been developed. Another example of our investments under OPO has been the Lancet Countdown, which I think is very widely known now as a means of tracking positive and negative outcomes of what's happening in the climate system, what's happening in our response to this. And this has been an immensely valuable tool for policymakers to understand sort of where we are in the current trajectory. We're currently coming to the end of our Planet Our Health 5-year programme, and Wellcome is now coming to the end also of a major strategic and scientific review, which will result in a very significant shift in the vision and structure of the organisation, while keeping discovery science at its core, and that's really what Wellcome is really well known for, investigator-led, high-end discovery science across a broad range of health-related activities. It's now going to focus its collective efforts more specifically on 3 major global health challenges, and this includes infectious disease, which of course is its what it is very familiar with, mental health, which is an increasingly important global health challenge, and climate change. And that is, I think, going to be a major opportunity for all of us going forward. So why has this been so difficult and so long to put together, if you like, a major health funder investing and thinking about investing in the environment side of things? I think there's a number of reasons for that. Mainly, it's really kind of difficult. And from a federal, from a government level, if you look at how science is funded, it's funded usually through very defined disciplines. In the US, we have NIH, takes care of the health side. We have NSF, which does an awful lot of innovative modeling on the environment, etc. But it's hard to get the different agencies to really work together and build programs. They have done it occasionally. They do certain activities, but as core business, it's not really what they do. And also health, to be perfectly honest, has been slow to engage with the climate agenda. From the WHO really first mentioned climate change at the leadership level in 2008, when Margaret Chan, who was then the Director General of WHO, gave a speech at Bethesda, NIH, and likened climate change to one of the 5 horsemen of the fifth horseman of the apocalypse, not one of the 5 horsemen. So, it's taken a while for the health community to really appreciate the health significance of climate change. There's a long history of that. I'm not going to go into that in particular, but working across disciplines is difficult. We have silos, we have different cultures, etc., which Kerry has already alluded to. And but also what she mentioned, which I think is absolutely critical, is that health, we know, is often led by the health sector in terms of political discussions, but actually contributed by all of the other sectors in terms of how you improve health. So you improve health through better nutrition, good agriculture, good transport, good housing, good education. All of these areas contribute to public health. And so there's a kind of challenge when the health sector is only really responsible for the hospitals, the vaccinations, the sort of fairly directed public health activities, and getting that to happen. It really has to happen at the government level. It has to happen in cities. It has to happen across lots of different organizations that can easily be siloed. So I think what is a great thing now, though, is that the health sector is increasingly interested in climate. And you may be aware, the UK's government and other governments around the world are increasingly committed. The UK is committed to reaching net zero by 2050, which really means transformation of the energy system, transformation of the transport system, housing, behaviour, etc. And as part of this, the UK's National Health Service, which is, for the UK population, it's our national treasure, it's beloved by the public. It has a net zero plan as well, which it has the vision, and it is mobilizing resources and planning around. So these are complicated things to do, but you can see now that the health community is really taking some leadership in this space. And I think it's a really exciting development that we can think about. So Wellcome, of course, has big opportunity because of its independence. It has resources, it has political independence, it can create its own timelines, its own mandates, it can work with different partners that maybe other organizations might find harder to do. And so I think it has the opportunity, if you like, to break down some of these silos, but it won't deliver its vision without working with partners as well. So I think that's really important. And I think they're also, if we look at what's happened in the investments in climate change and health, they have predominantly been around co-benefits, which really have had a focus on developing countries, where obviously decarbonisation is incredibly important for the global impact, and where changes in human behaviour and in our energy system, etc., is easier, if you like, at least conceptually, and we have the resources to do it. It's much harder, I think, to think about adaptation and resilience and the type of programs that are going to be really important in developing and middle-income countries where they're not currently major contributions to climate emissions. Adaptation and resilience are difficult concepts. We don't really know what the end point is. It's going to be a harder research agenda, I think, to develop in going forward. So I think there's some just naturally complicated things, if you like, combined with these silo issues, etc. But and that is in addition. You've got all of the issues around data sharing across sectors, which is really important. Capacity amongst the research community and the practitioner community to work together, which I think is really still very challenging. And to engage policymakers from different sectors. And I think Kerry's point about if you want to talk health at the political level, you need to find the health allies who can represent your contribution. And that's really, really important. But equally, it's important to get health into other sectoral decision-making processes and find the language that will help other organizations to do that. So sort of what are the mechanisms that now, well, we've seen already initiatives from others that are seeking to break down some of these barriers where funders have come together. The Belmont Forum is, I think, a great example of this, where you've got funders from different science funders from different countries coming together with some foundations, with different interests, trying to put together a pool of resources where the climate funder could fund the climate component of a program, the health funder another one, those interested in funding deforestation, etc., will put their resources together. And as a result, the collective pot allows people to cross mandates and work together. It is complicated, and I think the challenge really has been for the scientists to engage in programs like that, is that it's not the same as just putting your brilliant idea together and asking for the money to do it. You're having to consider various political issues and which countries you need to engage, etc. So there are attempts to do this, but there's a lot of room, I think, for improvement. And we could think about stronger health funders joining the Belmont Forum or working in partnership or looking at how they've developed the platform, but creating a platform where health outcomes are the dominant area of interest, but bring in funders from other areas. So I think there's a lot of different ways going forward. And I'll be very interested actually in following up on this discussion later on, but I don't think we'll have time to do that in this meeting.
Good. Well, those are very exciting developments. So thank you, Madeline. And the final panel question goes to Ari. Ari, you've been a key voice for quite some time now, raising warnings that, if we as a global society fail to recognize the relationships between the environment and humans, and that if we fail to care for nature, we'll face significant consequences to our well-being. you've raised the red flag around the current and potential impacts to human health from the climate change. And now with COVID-19, that's brought the connections between nature and humans back to the forefront, such as how deforestation is leading to new emerging infectious diseases and how climate change and air pollution is making COVID-19 outcomes worse. And when we spoke recently, you mentioned you felt like this year you've been doing speech after speech and engagement after engagement. And I'm wondering what your thoughts are on how we transition from speaking about these issues and their interconnectedness, which is important, but into more unified action. And then if we have time, you have a very varied background as a physician, an educator, and a scientist. And I'm curious what your thoughts are on what the academic, scientific, and healthcare communities can do to better help policymakers address these tangled issues like the ones we're discussing today.
Well, Phil, I give you credit for asking questions that are indicative and requiring brief responses. So I'm going to try and get all that in as minimal time possible. But I think in part, Phil, what you ask is really answered already by Kerry and Madeline. I have been at this a long time. I was a part of the first center in the world based at a medical school that focused on the health effects of global environmental change. That was started in the 90s. It was supported at the time. It was actually a UN and WHO collaborating center. But it was a byproduct of the Rio Earth Summit. And at Rio, which was arguably one of the most important environmental meetings in history, where you had pretty much every head of state present, the people who founded our center had a session there, which is where is health at Rio? Because everyone was talking about climate change as a problem for polar bears and biodiversity loss as a tragedy, as if all these problems didn't matter to people. And so we've come a long way, and you see it in WWF. I mean, WWF's report, the report that Kerry mentioned, was outstanding. I mean, here's a conservation organization that published a very compelling, concise summary of the evidence directly linking conservation objectives with health outcomes that matter to people around the world in their own lives. I mean, everybody can see coronavirus right now. And you think about the program that Madeline is in charge of at Wellcome Trust, the Our Planet, Our Health mechanism. To me, it was like, I've lost almost all my hair, and I'm mostly gray in what's left. But I have had grown bewildered of major foundations, which had enormous funding streams to climate change and enormous funding streams to healthcare, and they refused to do anything together. And Madeline's point about the United States, this is acute because NIH will, there's a less than a fraction of a percent of NIH funding directed at climate change and health, and that's being generous. And NSF is not mandated to look at health. So the federal government wasn't sponsoring. The private foundations were more or less AWOL on climate change and health until relatively recently. But we've seen this trajectory, and I think the best and shining example of that is what's happened at Wellcome Trust. And so we see this. But we also see it in the EU. 20% of EU stimulus funding is going into green projects, right? This is not by accident. This is by decades of work to get the understanding that our health is intimately connected to the health of nature into the hands of policymakers. But obviously we have a long way to go. And the main thing I will say in that regard is the more we can make it personal, the more we can make it matter to people's lives where they are right now. We've started too much from the expectation that everyone is going to care about a forest halfway around the world, or that carbon or water as a sort of out-of-body ethereal entity is going to have intrinsic value to people where they're living. No, and what's, if there is a silver lining from COVID, and arguably that's a hard claim to make, it makes clear that if we're going to make progress on things like COVID or climate or conservation, we have to recognize that the crisis of the moment is where people's minds are at. And it could be a pandemic. It could be them losing their job. It could be displacement. It could be 13 other things. And if we can't connect the goals of climate change and conservation to those ends, we will be displaced all the time. But the reality is that we can. And that's why talking about health is so critical. If you can, no matter how rich you are and how privileged you are in the world, you are still at risk from coronavirus, and you're still at risk from climate change. And that makes health a transformational communication piece. And I think Kerry alluded to the reality that it's not just the message that's the health message that's so critical, and importantly, an empowering message. We talk way the heck too much about doom and gloom, and we need to talk way the heck more about what we stand to gain, particularly for the most vulnerable. But the messenger, as Kerry pointed out, is critical. And so we increasingly realize from coronavirus how critical local voices are, that people trust many people closer to themselves. And then you ask Phil about, what people in academic and scientific and healthcare can do. Well, we can do that. We can be a part of that research. We can be a part of the messaging. I'm constantly working with my colleagues to figure out how to ask questions that clarify the paths from global environmental change to health. We wind up in analysis paralysis. Academics want to drill down into something into incredible nuance that has, obvious relevance to science and obvious relevance to progress in that sense, but is not going to help us solve the challenges we face. And so we have internal work to do for sure. But we also need to show, and this is where it gets into like the policymaker piece, you specifically ask in the context of policymakers, that our salvation is cheap. And we're trying to do this. So a couple of weeks ago, I would argue a perhaps unprecedented collaboration of conservationists, economists, disease ecologists, public health folks, and social scientists got together and said, can we do an assessment of what it would cost to prevent pandemics? So we looked at what it would take to reduce deforestation in the places where these diseases emerged. I mean, the things that were in the WWF report are here. What would it take to address the wildlife trade risks? What would it take to address doing better surveillance around spillover and where it might emerge? And when you do that economics, you realize it's about $20 to $30 billion a year, which sounds like a whole bunch of money until you realize we spent $10 trillion on this one disease. And as Paulette's remarks made clear, we've got a whole slew of these. HIV is about a $50 billion cost to this world alone. So we have science as an opportunity for science to really bring these issues down to size, to talk directly about the personal health effects, to talk directly about the economic value that's being lost because we failed to prevent. And the great news about this is that when you think about these actions, which I like to call primary prevention at a global scale, right? These are, we talk about primary prevention of infections with vaccines. Well, this is primary prevention of pandemics. That when you start doing these things like preventing deforestation, the value proposition is enormous because, of course, the forests don't just, chopping them down doesn't just promote emergence. It releases carbon. In many parts of the world, it results in is a consequence of fires that kill tens of thousands, sometimes hundreds of thousands of people, critical for water supplies. And so when you can use science to clarify what is on the table, and then you take that knowledge and you put it into the places that people already care about, and make it personal and compelling, then we see what happens in society. It becomes a deal we simply can't afford to refuse. And that's what I'm hoping that we're going to see. And that's why I'm delighted why things like Climate Week have embraced this kind of idea. I mean, the fact that J&J is sponsoring an event that's focused on a broader lens than simply carbon is critical because we absolutely need to connect, for instance, the huge sums of money that are flowing into global health right now as a relative function of what's going into conservation. There are about $2 billion spent annually on deforestation prevention in the world. That's probably being generous. And that is a fraction of what one organization, the Global Fund to combat HIV, TB, and malaria gets in its current spending cycle, which is about $10 billion. And we have to get the folks trying to prevent and treat HIV, TB, and malaria in the places where these diseases emerge, working on conservation. And we have paradigms to do that. And I'm hopeful that as we connect these dots and make it more personal, we can leverage the interests in global health and human health into the conservation efforts that, of course, are essential to protecting nature, which is essential to protecting ourselves.
Thank you, Ari. Wow, that's a lot to digest. I'm mindful of the time, and so we did receive a few questions for the panel through the Climate Week website. In the interest of time, we've done our best to group them and pick some key themes. So I'll see what we have time for. But one of the things we didn't discuss yet here today on this panel is the role of the private sector. And, I know, Kerry, you guys do a lot of work, the private sector on conservation and climate initiatives. And so I just wanted to ask each of you just briefly, again, with connections between climate deforestation and health outcomes being identified and raised, how do you see the role of the private sector shifting to address these issues? So maybe start with Kerry and then we can open it.
Sure, that's a great question. Well, I think we've already heard, and I've talked about, obviously, what J&J is doing in terms of the intersections of, or connecting deforestation, climate, and human health outcomes. So I think, we're obviously really excited to be part of that conversation. I am observing, well, I'll mention, there's a favorite quote I have from Desmond Tutu, which is about, there comes a point where you need to stop pulling people out of the river and go upriver and find out, why they're falling in. And I was reflecting on that because I've observed that more companies are moving away from having completely separate environmental and social goals. So trying to, it's a bit of getting upstream on that. And it reminds me actually of a couple of years ago when companies started asking, how might what we're doing on forest conservation help to address our climate footprint? And I feel like now we've opened the conversation around how might what we need to do or we're going to do on halting deforestation or forest conservation, how does that benefit my customers, my communities, my suppliers? So I think we need to embrace that integration. And we have a moment now also, I think, to really consider that in the context of issues of equity and justice. So I think as we seek to align what we're trying to do as a society and the private sector as part of that, I think for companies, there's an opportunity to build a much broader constituency within companies for environmental sustainability efforts. And that's going to open up new opportunities and ultimately enable companies to be more effective in delivering on the goals they've set in the realm of sustainable development. Also, I think a theme that's come up in this panel is just sort of who wields influence and who can bring certain messages. And there are spaces within which the private sector wields influence that NGOs or scientists really don't have as much opportunity to do so. So I think there's going to be opportunity for the private sector to step up more in this space. I think we're still at the beginning of seeing this shift, but certainly this event and sort of what we're seeing at Climate Week, it's all really exciting. And I think we're, as WWF, really excited to consider kind of the relationships we've had and the new relationships we can forge working across sectors in that regard.
So we have a minute or two for another response. Ari or Madeline, do you want to add anything to that?
I just wanted to do a quick plug because we have Climate Week here in New York, but in the UK we of course have COP26, which was delayed from this November to next year. And one of the things I think we're seeing, and I think it's very significant, is that the private sector moves faster than government. And so really pushing on the private sector to push government is also really important. And of course, the public have a big role to play in scrutinizing what different companies are doing and making it clear whether or not they approve of how those companies are evolving and where they're putting their efforts, and that it's not just sort of greenwashing activities, but they're really serious about the type of work that they're doing to improve the environment and improve our health. So I think public and the private sector combined and can also then drive government to be more effective.
Okay.
I'll add one quick remark, Phil, if I may. One of the most pernicious myths around climate change or conservation actions is that they're deadly to the economy. And there's no, the voice that is most important to debasing that is coming from the private sector. So I think it is critical not only that we see companies like J&J making bold commitments to decarbonize and not just saying them, but doing them. but that education of the employees as to why this is critical to the success of the business and how it is a growth opportunity for corporations. And in fact, and this is, one of the sad realities of the current stance of the United States on Paris is that if countries pull out of international frameworks on green technologies and advancing decarbonization, they're at a competitive disadvantage. And so we've got to make sure that the most trusted voices to that message, which are the leaders in the private sector, are being very clear with the people who work in those companies. Now, the good news is, of course, is that people who are my students right now, they won't work for companies that don't pay attention to this. And so there's also a talent issue for companies that if they're not paying attention to this, they're going to miss out on the best and the brightest. So there's all these reasons, but it's just critical that we do away with the nonsense of acting on climate as somehow being bad for jobs, bad for economic growth, bad for the private sector, because it's being used as a way to stall.
So we are at time, and I want to thank you all so much for joining us today and sharing with us your tremendously helpful insights and inspiration. And on behalf of Johnson & Johnson, I want to share my thanks to all who have taken the time today to see and hear our panel discussion. I hope that it was enlightening and that it triggers many additional thoughts and discussions. And so to close our event today, I would like to introduce Sally Uren, the Chief Executive for Forum for the Future, who, like Madeline, is also joining us from the Greater London area. I would say that Sally is quite the aficionado and champion of systems thinking and approaches, but I'm afraid that might be an understatement. So Sally is now going to give us her closing thoughts on how all of us might better address complex and tangled issues like the ones we have discussed today. So Sally, please proceed.
Thank you very much for the opportunity to share some closing remarks today. And I want to start with a quote from Donella Meadows, who was one of the early pioneers of systems thinking. And she famously remarked, this was 20 years ago, "The world is a complex, interconnected, finite, ecological, social, psychological, economic system, but we treat it as though it were not, as if it were divisible, separate, simple, and infinite. And our persistent, intractable global problems arise from this mismatch." And 20 years after she made this statement, at the start of this new decade, that statement was still pretty much true. But less so now. COVID-19 has just raised our public consciousness about just how interconnected our world is. A world where planetary health equals human health equals economic health. And with this greater understanding of the interconnectivity of the world around us comes an opportunity to deliberately and thoughtfully start to understand how can we drive systemic change for sustainability. This is really important because my view is that nothing short of systemic change will drive the ambition of the SDGs and will help us avoid the worst impacts of our climate emergency, our public health crisis. But what do we mean by systemic change? It's a word that we hear a lot about at the moment. Systemic change happens when the goals of a system shift, where new ways of working emerge, where new relationships emerge, and where connections are formed in different ways. Usually systemic change is a result of big macro level pressures from demographic change, climate change, biodiversity change, beginning to impact day-to-day life. When these pressures reach the day-to-day and they're combined with individuals willing to act to do something differently, then systems begin to change. And in particular, when innovations start to bubble up from the niche of our systems, coupled with that willingness to change, coupled with that pressure bearing down on our day-to-day, systems begin to shift. And when we think about renewable energy, that's what's happening right now. The energy system is shifting from underneath our eyes. If we think about the rapid shift we're now seeing from fossil fuel dependency to renewables. COVID is changing every system around us with usually very profoundly negative impacts. It's changing our health system, our finance system, the very way in which we operate as communities. But out of this moment of intense discontinuity, because everything is shifting, there's an opportunity to think about how do we reconfigure these systems? How do we use all of this change to actually pivot systems towards sustainable development? and change the goals of the system. And the word goal is really important. We often hear the narrative, systems are broken, the food system is broken. To take that case in point, the food system isn't broken. It's working pretty well to the goals of the current system, which is cheap food produced in a mass production fashion in a way that doesn't really bear a nod to environmental issues, doesn't really look at social issues. It's working pretty well to the goals of the current system. So our systems aren't broken. What we need to do is to redefine those goals. So with this moment of huge discontinuity, we can really think about how do we change the goals of the system that we rely on? And in order to do that, we need to accept the interdependency of the goals of the system. So when we think about the economy, we now know that a healthy economy is reliant on a healthy population. We know that a healthy climate system is reliant on healthy ecosystems. So driving systemic change starts with redefining the goals of the system. We then now need to design for that systemic change. And I'd like to offer 3 Ds as a way of understanding how we design for systemic change. The first is diagnosed. Take a moment to understand the connections in the system that you're focused on. Where are those interconnectivities within the system and outside of the system? This is where systems maps can be really, really important. The second D, decide where to act. Use that understanding of the interconnections to pinpoint those leverage points or those areas to act that if you're to focus on them, you drive positive change not only in the system that you're focused on, but in the broader systems that are interconnected. And then thirdly, we need to design for transformational change. So change that is not just incremental, but change that's catalytic. So if we think about the intersection of the forest and the finance system, we know that a really powerful leverage point there is new financial instruments. And things like forest-backed bonds are catalytic because they not only provide income sources into indigenous communities, they help secure the forest, and they can even help improve biodiversity. So we need to design for catalytic change and then change that's self-sustaining. So often we conceive innovations, we put them out to the market, and we wonder why actually those innovations haven't scaled. We need to think about what's the design of the enabling environment around that innovation. What policy do we need? What financial mechanisms do we need? So when we think about health innovations, what are the behavioral change designed outputs that we need to consider at the start? So that's how we can design for systemic change. It's also important to remember we need new skills. So not only do we need to be better at understanding the connections in the world around us, we also need to understand different timescales. We need to think about designing for change in the short and the longer term. We need to test our assumptions. What's going to be true to enable my catalytic change outcomes to come to pass? And finally, we need to learn to work better with both activating voices, so those voices that want to create change, and those resisting forces. There's a great saying, which I've really experienced in my career: the closer you get to shifting a system, the more it pushes back at you. So understanding what's pushing back at you and working with those resisting forces becomes really important. And finally, going back to Paulette's opening remarks, we all need to wear more than one hat. Designing for systemic change means understanding different perspectives, understanding that we can only see one part of the system from our viewpoint. So how can we move around the system and engage in those different perspectives? So driving systemic change in many ways has never actually been more possible given all this disruption around us. But I'd like you to leave you with the thought it's never been more important. At Forum for the Future, we've been tracking the trajectories that we are observing coming through this crisis, and we're seeing multiple different versions of our future unfold in front of us. The trajectory that we want to pay the most attention to is a transformed trajectory. That is a trajectory where we deliver the Sustainable Development Goals. And I'd like to leave you with a thought that the future isn't something that happens to us. The future is something that we can create. So what we all do, no matter what role we're in the next 6 to 18 months, has never been more critical. So it's time to drive systemic change for sustainability, and it's time to create the future that we want. Thank you very much.